Your vet prescribed Metacam for your dog, but here's what most people aren't told. Switching to another painkiller doesn't necessarily make it safer. In fact, many alternatives carry the exact same risks. So what's really going on? Metacam is one of the most widely prescribed pain medications for dogs, but it's also one of the most misunderstood. If your dog has arthritis or just had surgery, there's a good chance you've encountered it. Let's break down what it actually does, how safe it is, and what your real options are. What is Metacam? Metacam is the brand name for meloxicam, a non-steroidal anti-inflammatory drug, an NSAID. It works by reducing inflammation, which in turn reduces pain. It's similar in function to human drugs like ibuprofen, but never give human NSAIDs to dogs. Who makes it? Metacam is produced by Boehringer Ingelheim, a major global veterinary pharmaceutical company. It's been used in veterinary medicine for decades and is considered a standard treatment for pain and inflammation. What is it used for? Primary uses: osteoarthritis, chronic joint pain, post-surgical pain. Also used for injuries, dental procedures, inflammatory conditions. It doesn't just mask pain, it reduces the inflammation causing it. Who can use it? Commonly prescribed for dogs, main approved species. Use with caution. Cats, very limited, often single dose only depending on region. Older animals, pets with kidney or liver concerns. How long can dogs take Metacam? It depends on the condition. Short-term, surgery or injury. Long-term for arthritis. Some dogs stay on it for months or years, but only with monitoring. The key rule: use the lowest effective dose for the shortest time possible. Side effects: like all NSAIDs, Metacam affects more than just pain. Common: vomiting, diarrhea, reduced appetite, serious stomach ulcers, internal bleeding, kidney damage, liver issues, red flags, black stools, lethargy, increased thirst, yellowing of gums or eyes. If you see these, stop the medication and contact your vet immediately. Risks and safety: higher risk dogs include seniors, dehydrated pets, dogs with kidney or liver disease. Never combine NSAIDs together. NSAIDs with steroids. This dramatically increases the risk of ulcers and organ failure. The truth about alternatives. This is where a lot of misinformation happens. Drugs like carprofen, firocoxib, robenacoxib are often called alternatives to Metacam. Technically, that's true. Vets do switch between them. But here's what most people don't realize. These are not safer category alternatives. They are the same type of drug. They all belong to the NSAID family. What that means: same mechanism, same core risks, slight differences in how dogs tolerate them. So why switch? Because individual response varies. One dog may get stomach upset on Metacam, but tolerate firocoxib. Another may show liver changes on carprofen, but do fine on something else. Switching is about finding the best fit, not eliminating risk. What switching does not do: it does not remove the risk of side effects. It does not make the treatment inherently safe. It does not replace proper monitoring. True non-NSAID options. If NSAIDs aren't suitable, vets may look at targeted arthritis therapies, joint support strategies, weight management, physiotherapy. These approaches often support or reduce reliance on NSAIDs. rather than fully replacing them. Metacam can dramatically improve a dog's quality of life. But here's the honest truth. There is no risk-free version of this type of drug. Alternatives often carry the same underlying risks. Safety comes from correct use and proper monitoring.